Occupational English Test, Practice Test, Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information you hear. Now look at the notes for extract 1. Extract 1, questions 1 to 12. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
You hear an optometrist talking to a patient called Aidan Fitzpatrick, who has been experiencing blurred vision.
Hi, Aidan. I'm Dr. Solkeld. Could you start by telling me about what's been going on with your vision?
Sure. Well, I guess it must have started a while ago, but I didn't really notice it properly until about 2 weeks ago.
Right.
I was working in my garden and I noticed that I was having a hard time reading the instructions on the gardening products that I just bought. I normally stick to the one I've been using for years, but I thought it'd be nice to try something different. Anyways, it kind of felt like everything was fuzzy around the edges and I just couldn't see the letters clearly.
Good.
After talking to my daughter, she mentioned that I've been using increasingly more light to read at night and even pulling things closer to me to read.
Good.
I hadn't even noticed. So I went out and got some of those glasses they sell at the pharmacy and they helped, but my doctor said that it'd be better if I came to see an eye doctor. Well, they made things less blurred anyway, I guess. My vision's still not crystal clear or anything when I use the glasses, but I wasn't really expecting that. I still notice that I'm squinting to see things.
Right.
It's mostly when I'm trying to read something close up, like small writing. I'm better when things are at a distance. I don't know if it's related, but I've also noticed a pretty persistent headache. I guess it's kind of at the sides of my head, I suppose. It comes and goes, but it's definitely worse when I'm having trouble seeing something. When it gets really bad, I just take a fast-acting ibuprofen, and that tends to sort it out.
Ever had any vision problems before?
When I was little, at some point in elementary school, I think I had glasses, but I'm sure I broke them, and we just never got round to having them replaced. My brother has glasses that he's been wearing for years. I don't really know a whole lot about what's wrong with his eyes. Maybe he's short-sighted. Oh, but that reminds me. My brother thought I should mention that a couple of months or so ago I was pretty ill. I was suffering from sinusitis. And anyway, I left it pretty late to go and see the doctor about it. Kind of thought that it would just sort itself out. Anyway, it lingered for a while, so when I told my doctor, he gave me some antibiotics and it cleared up pretty quickly after that. Well, for the most part, although I still feel like I have a cold. Other than that, I've been in really good health for the last few years. I take my health really seriously. I'm not sure if the doctor told you, but I used to be quite overweight. But I lost it all after a bit of a wake-up call some years back. I had what you guys call a myocardial infraction. It was pretty scary, and I was quite overweight at the time and really stressed out about my job. Since then, I've made a real effort to look after myself properly.
I'm glad to hear it. So, in terms of your blurred vision, what do you think might work for you?
Well, I don't particularly like the idea of wearing glasses all the time, but touching my eyes freaks me out, so contact lenses are definitely not an option. I guess the best thing might be to just have glasses that I wear all the time, so I don't keep forgetting to put them on when I'm out somewhere and not at home. I've actually never had an eye test, so I should probably schedule one of those as the next step.
I think that sounds reasonable. Let's do some tests to check out your eyes and go from there.
Extract 2. Questions 13 to 24. For questions 13 to 24, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Oh, good morning. It's Mrs. Cooper, is it?
Yes, that's right.
And who have you brought with you today?
Well, I've brought my grandson Riley with me because both his parents work, so I often look after him during the day.
All right. Well, look, come on in and have a seat.
Thank you.
Okay, now, what seems to be the problem with young Riley?
Well, poor Riley, as you can see if you look at his hands, he's got these red scaly patches and they're always itchy. And he's got some on his knees and his tummy as well.
Oh, that's no good. Tell me, how long has this been going on?
Well, it flares up from time to time. It's particularly bad just now, but it's only been in about the last year that he started to develop this itchiness.
I see. And can you tell me a bit more about the scratching? Does he scratch a lot?
Yes, when it gets like it is now, he keeps scratching at it. And as you can see, they become very cracked and weepy.
Okay. Has there been any associated infection?
No, I haven't noticed that.
Well, that's good. Does this condition wake him up at night?
Yes, it does sometimes. He wakes up crying, actually, which is really bad and upsets everybody.
Yes, yes. Well, it would be hard on the family and, of course, Riley.
Yes, definitely.
Now, regarding school, has he had to take any days off because of this condition?
Well, see, I've taken him out of school today, and he does from time to time as it flares up like it is, and he's upset and we have to keep him home.
I see. Okay, now, what have you done to relieve the itching?
Well, I use that old-fashioned idea of calamine lotion, but that didn't really seem to help. And my daughter's got some cosmetic creams that are supposed to help, like moisturisers. We tried that too, but they don't seem to work.
Yes, I see. Okay, Mrs. Cooper, well, let me have a look at Riley first, and we'll see if we can determine what the actual problem is. Okay, I've had a look at Riley, and based on my examination, I think your grandson is suffering from a condition known as eczema. How much do you know about eczema?
Well, I've heard a bit about it, and that's actually what we suspected, but we really don't know what causes it to flare up. Maybe it's an allergy of some sort.
Yes, well, that's sometimes difficult to determine, but let me explain it to you. Eczema is also known as atopic dermatitis, and it's an inflammatory skin condition that often occurs in early childhood. Some experts say it might be related to an allergy, but to be honest, the exact causes of this condition are still not known.
Oh, well, that's a bit of a worry, isn't it?
Yes, look, I totally understand your concern, Mrs. Cooper, but just let me reassure you that eczema is a self-limiting skin condition. That means that most children will get better after a period of time, even without any treatment. And at this stage, with appropriate management, we can control the rash to some degree.
Well, we'll be happy to do anything because it's very hard on the boy.
Now, before we talk about these preventative measures, I'd just like to get a little bit of family information, if you don't mind.
Okay.
Now, can you tell me how many people are in Riley's family?
Well, there is his mother and father, of course, and he's got an older brother who is 9, And he's got twin sisters who are 5, and of course there's me. I have lived with them since my husband died 2 years ago.
I see. And do any of those family members have the same symptoms?
No, nobody has shown anything in the family.
What about yourself? Have you ever had this kind of problem?
No, I haven't.
Anyone else in the family? Aunts, uncles?
Well, now that I think of it, Riley's aunt, my daughter, I think she had it when she was younger, but I don't remember it going on very long or being as bad as Riley's.
I see. Well, one thing we can say about eczema, unfortunately, it does tend to run in families. That means that if one family member has it, then it's quite likely to appear in another family member.
Oh, well, I hope his brother and sisters don't get it then.
Well, as I said, it does run in families, so that if Riley has it, then it's possible that his older brother or younger sisters may develop it. However, I would say that because the risk is very low, there's no need to get alarmed about it at this stage.
Oh, well, that's good.
Now, apart from these hereditary factors, there are also environmental factors which can contribute to the condition, what we often refer to as trigger factors. So now I'd like to ask you some questions about the home environment.
Oh, okay.
Well, firstly, food can be a trigger factor. Things such as dairy products, wheat and eggs. Have you noticed if there are any particular things in Riley's diet which could be contributing to his condition?
Well, I think he has a very good diet, but I must say he's very fond of eggs, particularly scrambled eggs. It's one of his favourite dishes, and he does eat it quite a lot.
I see.
And maybe when I think of it, I'm not sure, but that could be a factor.
Okay, and when you say that, after eating these things like eggs and so forth, does he actually scratch more, or do you notice that the rash develops?
Well, I hadn't thought of it, but now that you mention it, maybe.
Okay, now eczema sufferers often have itchiness after baths or showers, and it can be caused by soaps, medicated soaps. Things like that can trigger the itching.
Well, as a family, we just buy whatever soaps are on special at the supermarket. We just get ordinary soaps to use.
I see. Well, we'll come back to that in a moment. Okay, now bath towels, clothes, sheets and the like can be a major contributing factor, and certain products such as wool, which can be quite abrasive, can cause reaction, and as a result the rash tends to flare up.
Well, of course, he only wears wool things if it's cold in winter. He just wears his ordinary school uniform, which is just a shirt and a pair of shorts.
Okay. Are there any pets in the house, Mrs. Cooper?
Yes, Riley has a dog that he loves, pet dog.
And how long has he had that dog?
Oh, about a year.
I see. Okay, well, you mentioned before he has had this eczema for about a year, or a little bit more, so that is something we might need to look at.
Oh, dear.
Now, are there any smokers in the house?
Well, his dad smokes.
I see. Does he smoke outside or does he smoke inside the house as well?
Oh, well, quite often he does have a cigarette inside, yes. I've told him to give up, but it doesn't work.
I see. Dust mites are another contributing factor.
Oh, I vacuum the house regularly. We keep the house clean. I am sure there aren't any dust mites.
Well, look, that's a really good thing to do, actually. But it can certainly help. However, dust mites can be found in all sorts of places. You know, even amongst stuffed toys and things like that in his bedroom. They often congregate in those areas.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B or C which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. Now read the question.
You hear a dentist discussing booking problems with her receptionist.
Hey Kieran, Mr. Lau just mentioned that he'd tried to reschedule his appointment yesterday, first online, and then when that didn't work, he called up. But apparently he couldn't reschedule. Any idea why?
I wasn't working yesterday, but let me check the notes. So, Lana left a note about the call. She says that Mr. Lau wanted to reschedule, but we didn't have any other appointments this week after 3 p.m., which is the only time he could make. He asked if he could make an appointment next week, but his procedure was marked on our system as urgent, so she had to make it in the same week. The system wouldn't have let her reschedule it any later. She wouldn't have had the authorization to change that. Still, she should have discussed this with you at lunch or at the end of the day, because then you could have decided whether it could have been postponed for a week.
Yeah. In his circumstance, it would have been fine to reschedule at a slightly later date. We should prevent something like this from happening again.
You're right. I'll talk to her about it tomorrow, and I'll send out an email to everyone else so that they're aware.
You hear a doctor discussing chest X-ray information with a medical student.
Hey, Dr. Yan, we've got the x-rays back from Mr. Regis in bed 8 from this morning.
Great. Can you document them in the notes?
Do you mind showing me how to write the interpretation properly?
Of course. Make sure you put the patient details. Full name, date of birth, patient number, and home address first. Then put the hospital and ward, date, and time. Make sure your name is on the document too. Include the indication for the x-ray like hemoptysis or dyspnea before documenting your interpretation. Now, I use a simple mnemonic to make sure I don't miss anything. A, B, C, D, E. Airway, trachea, carina, bronchi, and the hilar structures. Breathing, lung fields and pleura. Cardiac, heart size and heart borders. Diaphragm, position, shape, and costophrenic angles. Finally, everything else, the mediastinal contours, bones and tubes or devices. Make sure you document everything clearly using this system in the notes.
You hear an ENT surgeon talking to a colleague about cochlear implants.
We implant an electrode array which looks like several small wires made of a platinum iridium alloy into different regions of the cochlea. These metal wires conduct the electrical impulses generated from the microphone, which picks up sound from the environment and sends the signals to the electrode array through a transmitter. There's also a speech processor between the two that filters more important sounds so that the patient can hear people talking rather than other sounds.
Right, okay. So does this restore hearing to normal levels?
No. With the current technology, we're giving deaf people a good representation of sounds from the environment and help to understand speech. After surgery, patients undergo therapy to relearn the sense of hearing. Not everyone benefits from the device to the same extent.
Right.
You hear a GP talk about type 2 diabetes mellitus.
Hello. I'll be covering the diagnosis of type 2 diabetes mellitus. So there are 4 methods that we can use. The first is a fasting plasma glucose test. This is our preferred diagnostic test, as it's easier to carry out, often more convenient, and costs us less than the other 3 tests. It helps to try and book these appointments in the morning, as the patient has to refrain from eating for at least 8 hours before they can take the test. Normal fasting blood glucose will be between 70 and 100 milligrams per deciliter. A value of over 126 milligrams per deciliter indicates a diagnosis of diabetes. Bear in mind that this test should be carried out twice to confirm a positive result. The second method we can use is to measure the average glycemic load over the past 3 months.
You hear a dentist talking to a patient with a chipped tooth.
So we've talked about different options, and it seems like a veneer would be the best treatment. Given the cost of the procedure, are you happy to go ahead?
It's quite expensive, but I definitely need to get it fixed. Will it stay put?
Veneers tend to need replacing every 10 to 15 years, so they are a long-term solution. It will certainly be more durable than composite bonding, and it will look more realistic too.
Oh, okay. That's great. And is there anything I can do to extend their lifespan?
Well, you need to maintain good oral health. You know, brushing, flossing, regular checkups. You should avoid brushing your veneer too hard, as it could cause damage.
Okay.
You hear a podiatrist talking to a patient with fallen arches.
So, you say you're experiencing foot pain. Are you wearing supportive shoes?
I'm wearing appropriate shoes, and I'm also wearing orthotics that should be helping, but I'm still experiencing pain in my feet. Sometimes they feel a bit numb too.
Right, okay. And you mentioned that you've been given some foot exercises to do?
Yeah, the physiotherapist I went to showed me those. At first I thought they were helping, but now I think I'm as bad as I've ever been. Is there anything else we can do?
That is the end of Part B. Now look at Part C.
Part C. In this part of the test, you'll hear 2 different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B or C, which fits best according to what you hear. Complete your answers as you listen. Now look at Extract 1. Extract 1, questions 31 to 36.
You hear an interview with a physician called Dr. Tadita Hussain, who's talking about treating patients with cystic fibrosis. You now have 90 seconds to read questions 1 to 6.
Cystic fibrosis is a condition that causes mucus to be thicker and stickier than it should be. Dr. Tadita Hussain specializes in cystic fibrosis treatment and is here to share her thoughts on caring for people with the condition. Tadita, can you tell us a bit more about patients who suffer from cystic fibrosis?
Absolutely. Sufferers tend to carry 2 to 5 times as much salt in their bodies as those without the condition, so you can see why their mucus is thicker than average. Treatment for these patients is usually quite time-consuming and repetitive. Patients are often required to stay in hospital for long stretches, and as the symptoms of the condition begin to present very early on in the patient's life, many of my patients are young people, and so we tend to see lots of patients with cystic fibrosis finding these hospital visits frustrating.
Right.
In fact, throughout the UK, about 80% of patients with cystic fibrosis who are hospitalised report feeling at least minimal levels of depression.
How about young patients who aren't currently hospitalized? What can be challenging about their treatment?
Well, patients can be required to take around 30 pills a day to keep cystic fibrosis under control. So it's understandable that teenagers and young people who just want to be free and independent might resent this ordeal if they think they can get away with it. One of the most difficult things we have to contend with is the fact that if patients stop taking their medication or doing their daily breathing treatments, their condition won't immediately worsen. Instead, it will gradually become more severe until they contract a serious infection, which puts their lives at risk.
So, what approaches do you use when treating patients with cystic fibrosis?
Well, we've found distraction therapy to be extremely useful. We're incredibly lucky to have received a donation of a number of virtual reality headsets following their success in a number of treatment trials. We use the virtual reality headsets to transport the patient to outdoor settings, often corresponding to the activities they're required to do with us. When they complete breathing exercises on a stationary bike, for example, the VR headsets display a virtual outdoor bike ride. Our patients find it helpful to pretend to be somewhere else during treatment, and it's often easier for us to administer breathing treatments to patients using these headsets, as they're more relaxed when they're not focused on the actuality of the test.
So, what sorts of changes have you seen in your patients as a result of these methods?
One of my patients, a 24-year-old man with cystic fibrosis who was in hospital waiting for a lung transplant, well, he found treatment very difficult at first. He was preoccupied by his need for a transplant and frustrated by feelings of powerlessness. He would often resist treatment. We started using the virtual reality systems with him as soon as we got them, and it took a while for him to get on board, but when he did, it was like someone had breathed new life into him. Not only did he stop hindering his treatment, he actually began to look forward to it. He's even started helping us to think about other ways we can improve the experiences of our patients, like improving social interaction.
Yes, I understand that there are difficulties involved in patient communication.
We're looking into the possibility of instant messaging functions between patients, and even virtual games that they can play against each other. Unfortunately, patients with cystic fibrosis have to be kept apart to avoid cross-infection. It's just one more cross to bear for our patients, that they can't talk to those going through the same thing.
Right.
Our patients get plenty of interaction with myself and the rest of the staff, but we'd like to make sure they have access to a network of fellow sufferers too, for support and advice.
I see. That all sounds quite futuristic. Are there any other advances on the horizon for the treatment of cystic fibrosis?
Well, there's a new drug that's been in the news recently. It's a combination of lumacaftor and ivacaftor. You might know it by the brand name Orkambi. The drug works by improving the level of water and salt in the body, thereby reducing the thick mucus that causes illness and respiratory issues in those with cystic fibrosis. Even more exciting and futuristic, though, is the possibility of gene therapy, where the genetic mutation that causes cystic fibrosis in individuals is replaced with a healthy gene. This would effectively cure those with the condition and significantly extend the lives of thousands of people and remove the need for lengthy stays in hospital.
Now look at Extract 2. Extract 2. Questions 37 to 42. You now have 90 seconds to read questions 37 to 42.
My name's Dr. Neil Strathmore. I'm a cardiologist, and today I'm going to talk about cardiac investigations and try and tell you which test is right for which patient. Patients who present with heart problems present with a variety of symptoms, such as chest pain, shortness of breath, palpitations, syncope and edema. In addition, patients come along because a problem has been picked up by another doctor, such as high blood pressure, a heart murmur, an abnormal lipid profile, or patients present for assessment of cardiac risk to see whether they're likely to have a heart attack. Let's look at the most common cardiac symptom that presents, which is chest pain. Obviously, the first thing to do is to take a careful history of the pain, where it is and how severe it is, and in particular its relationship to exertion. Often patients don't describe this as a pain, but as a pressure. The examination is often not helpful in trying to sort out the cause of chest pain, but one should note the blood pressure and see if there are any cardiac murmurs, because aortic stenosis can also cause chest pain. It's important to note the risk factors. A technique that's very useful for assessing cardiac risk is to use the population data from the Framingham study in the United States to assess 5 and 10-year cardiovascular risk. It's important to remember that women often have an atypical history of pain. So the next step is to do some sort of test to look for the cause of the chest pain. And most of the tests are what are called functional tests, which see the effect of stress or exercise on the heart and see whether that changes something which can give us a diagnosis. The simplest test is an exercise ECG. The patient exercises on a bicycle or a treadmill while an ECG is being recorded. The parameters that are measured are the heart rate and blood pressure, and then changes on the ECG, in particular ST depression. ST depression occurs because ischemia occurs during exercise. This is a relatively simple test and inexpensive. The main problem is that its sensitivity and specificity are probably only of the order of 70 to 80% and seem to be a lot lower in women. Remembering that the test can be inaccurate means that a patient who has a very good story of chest pain that sounds like angina and has multiple risk factors should still be considered to have angina, even if...
That is the end of Part C. You now have 2 minutes to check your answers.